Hi everyone, my name is Jaren and my partner for this presentation is Isharneet. In this presentation, we will be talking about cluster analysis. I will be doing most of the PowerPoint information and Isharneet will be doing a walkthrough example of cluster analysis on RStudio. In this PowerPoint, I will be starting off by introducing cluster analysis and talking about the process of cluster analysis. I will then get into talking about what k-means clustering is, followed by k-mediates clustering. I will finish off the PowerPoint by talking about the use of cluster analysis in healthcare and some of the advantages and disadvantages of cluster analysis in healthcare. Isharneet will be taking you through a tutorial in RStudio to do cluster analysis with the IRIS data. So let's get started. What is cluster analysis? Cluster analysis is a statistical technique that is used to group data points into subsets or clusters based on their similarities. The main objective of cluster analysis is to identify patterns in the data that can help better understand the data. Cluster analysis has been widely used in various fields such as research, image analysis, and bioinformatics. There are several steps that must be taken to complete the process of cluster analysis. You first have to collect the data and prepare for analysis. This involves cleaning the data, handling missing values, and basically transforming the data as required. This is known as data preparation. Second, you have to choose the cluster method you want to use for your analysis. There are many methods available to use, such as k-means clustering, hierarchical clustering, and density-based clustering. Choosing which method to use depends on the data and the question being addressed. Thirdly, you have to determine the number of clusters. This can vary depending on the method you choose for your second step. The number of clusters may be predetermined or need to be determined through the analysis. One method to determine the number of clusters is called the elbow method. In this method, the sum of squared errors is plotted against the number of clusters and then choosing the number of clusters at the elbow point in the plot. The elbow point represents the optimal number of clusters where there is a good balance between the number of clusters and the quality of the solution. The fourth step is the cluster formation. By choosing clustering method and the number of clusters, the data will be grouped into clusters. The final step of cluster analysis is the interpretation. The clusters are interpreted in terms of the characteristics and similarities of the data points within each cluster. What is k-means clustering? K-means clustering is a popular, unsupervised machine learning algorithm that is used for cluster analysis. The aim of k-means clustering is to partition dataset into a predetermined number of clusters where each data point belongs to the cluster with the closest mean. K-means is a very simple to use and it is used in customer segmentation, image segmentation, and natural language processing. One limitation of k-means clustering is that it assumes clusters are spherical and of equal sizes, which is not true in all cases. This can be fixed by using hierarchical clustering, where it allows for clusters that are not spherical and of equal size. This is because they do not make any assumptions about the shape or size of the clusters. So what exactly are the steps to conducting k-means clustering? There are 5 steps involved in k-means clustering. First, you have to choose k-cluster centroids randomly from the data points as the initial cluster centers. K-cluster centroids are the cluster points in the data that represents the centers of the k-cluster. The centroids are calculated as the mean of all the data points assigned to the cluster. Second, you have to assign each data point to the clusters. You have to calculate the difference between the data points and each centroid and assign the data point to the closest centroid. This forms k-clusters with each data point assigned to the cluster represented by its nearest centroid. Step 3 requires you to recalculate the centroid of each cluster by taking the mean of all data points assigned to that cluster and set the centroid to be the mean. This updates the k-centroid to represent the centroids of each cluster. You have to repeat steps 2 and 3 until the cluster assignments stop changing or the maximum number of iteration is reached. Once k-means clustering finishes, you have to evaluate the resulting cluster solution. This is done by examining the characteristics of the clusters and visualizing the clusters using any visual tools. What is k-mediates clustering? K-mediates clustering is a clustering algorithm that is used in machine learning and data mining. It is a variation of k-means clustering. The difference between k-means clustering and k-mediates clustering is that k-means clustering uses the mean of the data points in each cluster as the center point of the cluster, whereas k-mediates clustering uses an actual data point in the cluster as center point. In k-mediates clustering, the algorithm selects k representative object called medioids from the dataset and assigns each data point to the nearest medioid. K-medioids works by identifying clusters of similar data points by continuing updating the medioid. It repeats the assignment and update steps until the medioids no longer change or maximum number of iteration is reached. K-means clustering has several advantages over other clustering algorithms. K-medioids clustering is less sensitive to outliers as it uses actual data points as medioids instead of the mean. This makes it a better choice for datasets with outliers. K-medioids has the flexibility of using it with any distance metric, whereas comparing to k-means clustering where it is limited to using the Euclidean distance. Therefore, k-medioids makes it more flexible to a wide range of datasets. K-medioids is capable of handling large datasets as it only needs to compute in the pairwise distance between data points and medioids rather than all data points. This algorithm is more interpretable since it uses actual data points. Therefore, it helps understand the characteristics of each cluster. Finally, k-medioids produce high-quality clusters for datasets with non-spherical clusters. Cluster analysis has several applications in healthcare. Cluster analysis can be used to segment patients into groups based on similarities in their health status, demographic characteristic, or medical history. This can help healthcare providers tailor intervention and treatments to the specific needs of each patient group. Cluster analysis can be used to classify groups of patients with similar symptoms or risk factors, which would help improve the accuracy of diagnosis and prognosis. Allocation of healthcare resources where geographical regions or population groups with similar healthcare requirements can be identified using cluster analysis. For example, cluster analysis can identify areas with high disease burden and allocate resources such as staff and equipment accordingly. This can help improve access to care and reduce healthcare disparities. Cluster analysis has several advantages and disadvantages when it comes to using healthcare data. Some of the advantages are that cluster analysis can be used to identify patient subgroups based on clinical characteristics such as age, gender, and disease severity, which can be used for targeted treatment strategies. Cluster analysis can help to optimize treatment and intervention, which would ultimately lead to improved patient outcomes. This results in reduced hospital readmission and lower healthcare cost. Some of the disadvantages are that cluster analysis can be sensitive to the quality of the data, therefore poor quality data can lead to inaccurate results. Cluster analysis can be subjective, which could lead to different results and make it difficult to compare studies. And finally, it can be a complex and time-consuming process when dealing with large datasets. This would require specialized skill, which might not be available in all healthcare settings.